Hello, everyone, and welcome back to my channel. I am your girl, Molinda Jae, and I'm here to talk about the former president, Jimmy Carter, is opting for hospice care, what it means, and how we should be leaning towards getting assistance with hospice care and allowing our loved ones to go out and transition peacefully rather than in vain. So let's go ahead and do that and share my screen. Okay. And this is coming from Yahoo News, and this was reported on yesterday, the 21st. And I believe the announcement that was made was last week for the of him opting for hospice care. So let's go ahead and get into this part and what it means. So it says Jimmy Carter has opted for a home hospice care. Here's what it means. What exactly is hospice care and how do patients decide they're ready to begin receiving it? Yahoo News spoke with an expert to help demystify end-of-life care. And this was written and reported by Rebecca Corey, okay? And as you can see here, here's former President Jimmy Carter in 2011. All right, so it says former President Jimmy Carter has decided to spend his remaining time at home and receive hospice care, the Carter Center announced on Saturday. The 98-year-old Carter has overcome a myriad of health obstacles over the last decade, including brain cancer, liver surgery, and hip replacement surgery. Now the longest living president is opting to spend his final days at his home in Plains, Georgia. After a series of short hospital stays, former U.S. President Jimmy Carter today decided to spend his remaining time at home with his family and receive hospice care instead of additional medical intervention. A statement read, he has the full support of his family and his medical team. The Carter family asked for privacy during this time and is grateful for the concern shown by his many admirers. Although hospice care is not uncommon in the U.S., with 1.6 million patients receiving it in 2018, according to the Centers for Disease Control and Prevention, Dr. Sunita Puri, Program Director of Hospice and Palliative Medicine Fellowship Program at the University of Massachusetts Chan Medical School. That is a mouthful, y'all. Oh my goodness. But back to the article. Of the Good Night Life and Medicine in the 11th Hour told the Yahoo News that hospice care is often misunderstood, and it is. I think this dichotomy between medical intervention and hospice care is a false dichotomy and is actually a continuum of care, Puri explained. Puri spoke with Yahoo News to help demystify hospice and end-of-life care. Some responses have been edited for length and clarity. Dang, I wish I would have read it yesterday. All right, it says Yahoo News, what is hospice care? According to Dr. Sunita Puri, I like to think of it as intensive comfort-focused care. It is provided with the goal of minimizing physical, emotional, and spiritual suffering that patients and their families experience when somebody has 6 months or less to live. Hospice can be provided at home, which is where the majority of hospice care takes place, but it can also provide a facility like nursing facilities and sometimes a standalone hospice facility. One thing that is very important for people to know is that hospice care is medical care. It is a medical intervention that is one that is one that is taken into consideration the totality of one's experience with serious illness and suffering associated with it. How does a patient or their family and doctors decide to begin hospice care? That is usually a conversation between physicians and their patients and their family based on a couple of things. One, we approach the point where either options to treat the primary disease are not working, or there are no options left to treat the primary disease. That's when people start having discussions instead of focusing on the disease, focus on the treatment of the system. In other words, when the doctor says, I'm sorry, there's nothing else that we can do for the patient or for you, that is basically the statement right there saying, hey, you might want to look into other alternatives, whether it's a nursing home, hospice facility, to facilitate and oversee the patient, because it won't be long until they transition. Okay. Furthermore, it says, I understand that there may be more treatment options, but it is my goal to focus on living well and having my symptoms managed for as long as I can have to live. So there's kind of discussion of prognosis or life expectancy, which is part of it. But the other interwoven elements are about suffering, quality of life, and how somebody wishes to spend their time. Who provides hospice care? Hospice care is provided by agencies usually. For example, I work in a system where we don't have our hospice agency. It's so very common for whoever your primary medical team is to offer you another organization that provides hospice. There are doctors, nurses, spiritual care providers, and social workers involved. Spiritual care providers is more like alternative medicine and holistic health. There you go. And sometimes there can be music therapists or physical therapists or occupational therapists, depending on the agency and patient's need. Musical therapists could be like a person that comes in and provides sound, the music that either the patient wants to listen to put them more at ease of the pain and suffering that they're going through. Or it could be the music therapist as a sound healer, like myself. I have singing bowls, and I do provide those services. So, and also there's various ranges of music therapists as well, but you get the gist. Also, it says, what happens during hospice care? When you start receiving hospice service, there is a team who will visit your home, and usually the nurse is the face of the hospice team. So the nurse will visit, evaluate how somebody is feeling in terms of pain or nausea or shortness of breath or other sources of suffering. The nurse will talk with the patient and family about other dimensions of what they are going through emotionally and spiritually. A physician oversees the whole plan of care and makes sure that the right medicines are being prescribed and that dosage changes are being made when somebody needs more than what we're giving them currently. The whole team talks about ways that they can meet individuals' needs and goals of the patients and families as they go through this process. Hospice is very much an integrative process. I don't know if I pronounced that right, but you get my drift. And a team effort. So where we start in terms of pain control or supporting the patient, that is very much involves as somebody gets sicker. So basically, this paragraph is saying that the hospice service will come to your house. The nurse will be the face of the team. They will ask a couple of questions to see the tolerance of the patient, the tolerance of the patient of how much pain they're in. Do they experience any nausea? What is the tolerance of the shortness of the breath? And the list goes on. Then the the nurse will speak with the family members. And because once the doctors at the hospital say there's nothing, I'm sorry, but there's nothing more that we can do to assist with the patient, because that is their sign, seal, and deliver statement from them to the patient and the family members. And then I don't know if they provide the hospice information to the patients and their families, but that is when the shock comes into play, because once the hospice care or going to a nursery home type of papers come into play, that's when reality really sets in, that time is limited and you're just gonna have to make the best of it. But like I said, the number one person that the focus is on when it comes to hospice care is the patient, because they are the ones going through the process. And then after the patient, it is the family members, because they are going to have to eventually get to a point, and it's going to take for some family members it's going to take longer than others, but it is slowly preparing you all to anticipated grief, because that's part of the griefs that I had researched and did with the Doula Institute, because that's another topic to discuss as well. I can't necessarily say it on YouTube, but it is, I'm gonna spell it, the DEATH doula, okay? Because that comes into play as well, which I've already have experience in that ever since 2009. I did not know it is a profession until I had assisted until me and my family assisted my grandfather to transition in the most proper way. The other family members, it was more of they were in the nursery home, to where it's beyond our reach. We can only visit and make sure they are getting the care that they deserve and need at the time. But when it's hospice care, you have a little bit more, I would say you have a little bit more control compared to nursery homes. And then, I'll take that back. I was introduced to a family member being into hospice care when I was in high school. So yeah, I have some experience in that realm. It's just, I didn't know to a certain extent that it was a profession to a certain degree, especially with some positions that I am coming across now, that it is a literal profession and that you can make a career out of it. So that's where I'm leaning towards, all right, as far as like my endeavor, because I've been called to do this for the longest, okay? And enough said on that, but we're going to continue on into the article. So that's basically what that paragraph is explaining there. Furthermore, how long does hospice care last? Hospice is technically if you have a life expectancy of 6 months or less, but in the US, hospice stays are around about an average 3 weeks. And I think that's unfortunate, because it speaks to the fact that we have a really hard time talking about these topics like suffering, quality of life, whether certain treatments are really adding to or taking away from someone's life experience. And because these conversations can be delayed, we have a situation where people are referred very late to hospice, so that statistics has been pretty fascinated to me and not surprising. And they're still interviewing the doctor that they're talking about, that's given expertise advice when it comes to hospice care. And those numbers are very astonishing. I did not know that the hospice stays are averaging 3 weeks in the US. That tells you the US is so behind on everything. Healthcare, education, infrastructure, all those things. We are really behind, y'all. And I agree with the doctor. It's because we don't talk about these topics because it's taboo for one thing, and it's a touchy subject to where you don't want to address it, but by the time you do address it, it's too late, to which it adds on into your psyche again, that triggers some type of emotional distress per se, or like a traumatic experience, because even though you were seeing the signs once before, it doesn't really set in until not only when it hits your own backyard, but also when it's like too late. Okay. So I'm not afraid of talking about those topics at this point, especially what me and my family have went through within these past years, assisting our family members to transition to the other side as peacefully as possible. I don't mind talking about these topics, and I want to hear your thoughts in the comment section below about this as well. If this is a particular topic that you want to talk about in further usage, and yeah, just let me know. Okay, either way it goes, I'm still going to talk about it because it's very, and this is why I put the video. The time is now. I am literally, it is sounding the alarm on what's to come. And even though we are focusing our attention on the wrong things, like celebrities acting a fool, fighting, brawling, breaking up and stuff like that, yeah, they're human beings at the end of the day, but they're there for entertainment. They can only entertain us for so long, but when it comes to life and the afterlife, that's a whole different story that we do need to grasp about. Okay, furthermore, along the article, it says, what is important for people to know about hospice care? Hospice is not about giving up or throwing in the towel or losing the fight or any of that. Hospice is about acknowledging where your body is at the given state of illness, and honoring that and honoring the person that you are, which is distinct from illness that you are suffering. I think it's really important for people to know that hospice is a very comprehensive, humanistic plan of care and service that really attempts to maximize dignity and minimize suffering when you are living with an illness that we cannot cure. And most illnesses cannot be cured. So thinking about when you would want to make a transition from treatments intended to prolong life to treatments that are intended to improve the quality of your life is a conversation I always encourage people to start thinking about at the time that they're given a serious diagnosis. I think it's really important for people to know that hospice care is very much centered on the needs of the patients and their families, as I mentioned before, and on supporting what's most important to them and what they value and what their goals are for their time on earth. And that is the end of the article on that. So again, you just got to send your prayers out and the healing energy and to the Carter family. He has been, from what I'm seeing from times and times again, as I look up his name in as far as like research purposes, I can say the least that he has been the most humanitarian president that we have had in the last 20, are we in the first in the century per se, because the rest of the presidents, for the most of the part, like some of them can't really be thrown away, tomato for the least. But Mr. President Jimmy Carter, he has been the humanitarian that has been putting his hand and foot in providing assistance for the greater good, like Habitat for Humanity, assisting with helping along building the houses for people who have been displaced due to natural disasters or the unforeseen circumstances that they had. But at this time, since he has opted for hospice care, And the time frame is usually 6 months. They'll say you have 6 months to live. Hey, we just got to keep our eye on Mr. Jimmy Carter. That's all I have to say. Keep an eye on him from afar and just continue to send out that healing energy to the Carter family as they are going through this time of cherishing every moment that they have had with their father, their grandfather, their uncle, and the rest goes on. 98 years old, that is the good life right there. You are able to reach almost 100 years old. So shouts out to President Carter on that one. But let me stop sharing my screen for a moment. But yeah, feel free to leave your comments down below on what you on your thoughts about hospice care. Have you and your family been through the hospice care with a family member, a loved one? Also, feel free to comment down below. Also, do you want me to go a little bit further in the topics that was discussed in the article and how people how all of us try to avoid the conversation that deals with the ending of life care or just the ending of life process, because we just don't want to think that further. But in reality, we do, because time is limited on earth. We have to cherish every moment as we are able to wake up every day, living and breathing and living our life the best way we can. But other than that, I'm gonna keep it short on here. I just thought I had to bring this to you all's attention for people who are not aware of hospice care and how hospice care is not the end all or be all when it comes to dealing with the patients being released from the hospital. And yes, it is a lot of work. However, it depending on what type of circumstances you are in. But with that being said, like I said, it's part of life, and we have to face it. We have to deal with it, and it's better to have knowledge of it than not have knowledge of it and still go through 10 times more of a traumatic experience than just for things that yeah, it's just better to know, okay, at the end of the day. But other than that, I'm gonna leave it here. Be sure to like, share, comment, and subscribe to the YouTube channel if you haven't done so already. Hit that notification bell so you know the next time I upload a video. And always remember to love thyself, know thyself, soothe thyself so you can heal thyself. And I'll see you guys in the next one.